It's another Tuesday evening, and I welcome you to Cafdil Healthcare here on Cafdil TV. Tonight, we are going to discuss influenza illness. What have you heard about the influenza virus or illness? How do you know if you or a family member of yours has contracted the virus? My name is Shadrach Samuel Adenu, and tonight, you can follow us on our social media handles: Facebook, Cafdil Cape Coast, YouTube, Cafdil EDU. My guests are already seated, but before we do that, let's go for this quick break. When we come back, we shall continue with the discussion. Stick and stay with us.
Since time immemorial, God has always communicated himself and his will through various voices: the prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program, because it is Voices of God from the valley of prayer and silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms: YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Lord, make me a means of your peace.
If you just tuned in, this is Cafdil Healthcare. Tonight, we are discussing the influenza illness. As I said earlier on, my guests are already seated. They are in the presence of Abu Kwabena, who is the disease control officer from the Cape Coast Teaching Hospital, and then Olivia Boatma, who is also a senior nursing officer, also from the Cape Coast Teaching Hospital. Gentlemen and lady, you are welcome.
Thank you.
Thank you.
It's been a while.
Yes.
You are looking good.
Thank you so much.
Good. So, madam, this is your first time here, right? You are welcome.
Thank you.
All right. So, Abu Kwabena, let's start from you. Influenza illness. What at all is it? Maybe somebody out there has already heard of the name, but we don't know.
Okay. All right. So when we talk about influenza-like illness, simply put, it's a respiratory disease. Okay. And one other way to make it a bit simpler is that, you see, the respiratory system has a lot of organs come together to form the respiratory system. See, any of this compartment of the system that are being infected is called a respiratory disease. Okay. And influenza-like illness is one of the respiratory diseases. Okay, so the disease-causing organisms are the influenza viruses. Okay, we have the A, B, C, and D. They are the viruses that are responsible for this influenza-like illness. One sickness has 4 or 5 causative agents. Yes, there are even more than that. But in our setting here, in Africa, in Ghana, within which Cape Coast is part, we have the A and B that is dominating. Okay, so we will emphasize or we will focus most on these two group of the influenza or the flu disease. The influenza-like illness are a group of illness that show common signs and symptoms. COVID is part of influenza illness because their symptoms mimic that of the flu that we are talking about. There are a lot of them in the SARS and other things. They all present flu symptoms. So they are influenza-like. The moment you see like attached to a particular thing, it means that their family behave like that. You understand? So influenza-like illness is a respiratory disease that is caused by influenza viruses, which is the type A, B, that will be focusing on. Yeah, that's fine.
Okay. Madam Olivia, when do we experience this kind of influenza illness? In which of the seasons?
Season, when you talk about season, this condition, it doesn't have any peculiar or particular season because it is an airborne disease.
Okay.
But sometimes it's usually come about or occurs during the Hamatan season. That's from the December to the February or the March.
Okay.
Because during that period, you see the weather changes, and because of the loss of dust.
Okay.
Because it's an airborne disease, so it's usually come around this season.
Okay.
So let me say from December there to February or during the Hamatan season. But since it's an airborne disease, anytime.
Okay. Right. Abu, you mentioned that it's a respiratory disease. Okay. The respiratory disease has to do with the lungs. But before it starts from somewhere before we get to the lungs,
yes.
Right? So I want you to take us through that process where.
Okay, so like I said, it is a system. So when we talk about a system, the focus is taken away from a single thing to a group of items put together or organs put together. So starting from the nose and then the tract leading to the lungs, they form part of the respiratory system. Okay, and like he said, they are different mode of transmissions as far as this flu or influenza-like illness are concerned. And the main one or the common one that the health system is aware that is responsible for the spread of the flu or the influenza-like illness is the airborne.
Okay.
Meaning that the disease-causing agent, which is either the A or B type, will be carried in the air, and then it is taken to people who are available at that time and probably breathe in that particular air that is infected with the
virus,
the organism or the virus. Then they are infected in the first place. So the next thing to look out for is either that particular individual who has been infected already has a protection against that particular virus or not. So if you have a protection, the meaning is that you might not develop the symptoms of flu virus.
Okay.
But if you don't have the protection, the next thing to look out for after infection is the incubation period. Then if the incubation period elapses, then you begin to show signs and symptoms of that flu-like symptoms. So looking at the system, it is through the nodes, through the tracts. So, you know, when we are picking your sample, we pick samples from all these three organs or tract issues leading to the lungs. So we pass a swab through your nose. That is how the health system has designed the whole protocols of picking sample for sample influenza-like illness investigations. Okay, right. So what it means is that when you have flu or influenza-like illness, one of the signs and symptoms include runny nose.
Okay.
see that you have coryza or your nose will be busy each time you want to clear your nose or blow your nose. So when we swab in there, if the fluid that is coming out contains any of the disease causing organism, it is easily picked up from that particular sample there. So the nose, we can take some sample from the nose. And that aside, you can also pick the sample from the throat. You understand?
Yeah.
That is where the tract links. So you can pick it from the throat to make sure that if the person giving you the complaint that, oh, I have sore throat, even I can't swallow and things, meaning that that tract is also infected. So we pick samples from that side to put together. That aside, if somebody is able to cough up and bring us a content from within the lungs, in the hospital setting we call it sputum.
Okay.
We are able to rely on that sputum to be able.
Is it the same as phlegms or?
Okay, people put it that way, but phlegms, people can pull it from their head, and bring it, but from within the lungs is the proper one, because looking at the system, we mentioned the nose, the tract, and then the lungs. So it means that if this system is infected, any part that you pick a sample from will be able to help you investigate accurately to see if it is a true flu-like illness that we are dealing with. You understand my point? Yes. So that is the dynamics around how the system links and it affects the disease distribution. Yeah.
Is the process painful? Because you need to pass something through somebody's nostrils.
Honestly speaking, because I work in that particular unit, from time to time I have to do it and then also see what is happening to me.
Okay.
Even though we all take the necessary precautions, we still think that yes, we are at risk group.
Okay. So have you been affected before?
Have I been infected before?
Yes, with the influenza.
For flu, I have not. I don't have any records.
Okay.
That I have, but for COVID, yes.
All right.
When COVID was on, I had it for the second time.
Okay.
First one and second one. So if it is COVID or flu-like illness, you still have to go.
You got it twice. Is it because you work as a disease control officer, or because you interact with people more?
Yes, I got it 2 times, and there are multiple factors playing that role.
Okay.
You know, sometimes when you are overwhelmed, certain things happens involuntarily.
Okay.
You see, they will happen, and then after they have happened, you now realize that this thing has happened.
Right.
It could be one of those things. It could also be that the mask that we are using has its own issues.
Right.
You might not put it on well, thinking that you are protecting yourself. Meanwhile, the viruses have their way, of infecting you without your knowledge and all those things. Then other aspect of it could be stress, which could lead to your immune system lowering and things. And if they are there, they can start showing what they can do. So you are likely to get it and like I said, during COVID time, the system wasn't friendly to some of us, especially the front line workers, because I hardly sleep like 3 hours on my bed. Sometimes around 11, I'm now coming from Noguchi.
It's a lot of stress.
Then I'll get here, and then I have to come and enter something into a whole lot of things. Then I have to leave my house around 4 and start entering communities, gather samples, and go back to Accra and bring results that other people are there waiting for, so that they can take clinical judgment and then other things. So stress can also be part. And so we take samples like that, and then we do investigations to see. So if you are talking about if it is comfortable, from where I sit as a health worker, I would say it is better in that direction than you getting the disease itself.
Right.
But on top of it all, it's not painful.
Right.
We have skilled personnel,
Okay.
the lab people who does it. Even though I can do, CCTH is a specialist clinic. Everybody, all group of health workers are there. So taking it takes a special skill, like any ordinary person taking. Maybe you will hear another sound of welcome, but in our setting, we are able to take it to a extent that you will not even experience it the way you think it could be awful or very painful. Yeah, it's never like that.
All right, thank you. Madam Olivia, what is the influenza illness the same as cold flu? What's the difference between these two? Because from the way Abu talked about it, it's more like the same. The one that when we have it, we call it cold flu, right? So what's the difference?
Okay, for the difference, what I would say is that they look familiar or they look similar.
Okay.
Just that the influenza has a long period than the normal cold.
Okay.
So because they all have the same signs and symptoms like the cough, the fever, the sore throat, and the rest. They are all the same. So to make sure that you are having influenza or you are having a normal cold is to come to the hospital.
Okay.
Yes. So it's only the hospital that can determine that you are having just normal cold, you are having the influenza, and that one is through the examination, through the labs, that will make one know that this is influenza or this is normal cold.
Okay. So what are some of the signs and symptoms that one needs to see them to help him or her determine that this is influenza illness, this is an ordinary cold flu?
Okay. The major difference between the common cold and the influenza is that the influenza, when it gets to some stage, you experience difficulty in breathing.
Okay.
Because as my boss was saying, it's a respiratory disease. Okay. So it has issue with the lungs. And we all breathe through the lungs, the bronchial and those things. So once it is affected, it will get to a time you cannot breathe again. So that's the major difference between that one and the common cold.
Sure.
Yes. And this one, you have a high temperature, let me say fever, and you have sore throat. So that one is the main difference between the common cold and the influenza.
Sure. Okay. So let's say, how long does it take for somebody to notice that they have influenza?
Okay.
The lasting period.
Okay, so if I understand you well, you want to talk about incubation period, right?
Yeah.
Okay, that's fine. So before I hit there, let me add something small to what my sister said. Looking at the difference, like he said, we would want to establish that don't wait to see any clear difference. After all, signs and symptoms don't show up just because they want to show up.
Right.
It is something that probably might have triggered it. So our focus is on the something. We want to know the something that triggered it, so that we will work and then deal with that particular something. So you behind the scene trying to predict this cold could be that of the common cold. So if I ask you what causes common cold, what would you say? Common cold is a general term that we all apply.
Okay.
We apply them interchangeably. The only thing is that the catarrh is there. You have stuffy nose.
Okay.
And then this flu-like illness, they also present the same. So there is nothing like common cold there, and then it is what they see. It's what the symptoms that people present that makes them put that category into common cold. But it's possible that the disease-causing agents could be influenza virus, it could be COVID, it could be even TB, it could be any of the pneumonia or respiratory diseases that are behind it. So for you to know what is happening, like she said, just approach the hospital setting. Let's help you investigate to find out the root cause of that particular symptoms that are coming out. In fact, when you also want to look at the differences so clear, now the difference is that even though the signs and symptoms are similar, the names of the pathogens or the disease causing agents or organisms, they are never the same. Even with the flu, I mentioned that there is a type A that is there. Coming forward, we'll talk about them individually, and then B2, they are there. Okay. Even though they are...
No, you can still touch on them. So
yes. So even though they are all influenza viruses, they have their different names. Okay. So even if I pick your sample and you were showing similar signs and symptoms, then I investigate and you were truly infected. Yes, so even within the A, there are subtypes. Okay, so we'll be able to pick one that will come with a different name. Okay, yeah, we can pick others with different names. So now let me take my time to explain. The types. Now let me start with the A. Now the A is the type in Africa that can cause pandemics, that can cause outbreaks. Okay, if I say pandemic, we all understand pandemic, right? Yeah. Yes, meaning the disease has a potential to cross countries. From one country to another country, or boundaries, let me say that. Then epidemics or outbreaks can be within or can be localized. Now if we say a disease is a pandemic disease, WHO has a criteria for deciding what is the potential or what could be a potential for a disease to be classified as
epidemic.
Now, a disease that the whole world, or a disease that has a zero or zero global immunity, that particular disease has a potential to cause pandemics. I'm saying this because now the disease becomes very new to the system, to the world. So we are now spending time to prepare a pragmatic interventions, which may include vaccinations. So whilst you are still working on it to get those interventions, then life must continue. This is where people will be moving from one place to other with the disease, and the spread of the virus becomes wild and viral. You understand my point? So if the whole world has a zero immunity for a particular disease, the potential of it escalating is high. Now let me come to how these viruses can all of a sudden create their own. Okay. You know, we humans, in our setting, we give birth to our young ones, right?
Yes.
Very good. You can give birth to a child. The child will copy your face and come and pick the mother's structure. Yeah. You understand?
That's the DNA.
Very fine. So it means that we are making copies of ourselves, but we can come not in the same copy. But a copy with a slight changes in it. So in the same way, the influenza virus type A, yes, they have what we call hemagglutinin and then neuraminidase. Okay. They have their function they perform. Hemagglutinin is to help the virus, this influenza virus type A, to adhere to the body surface or to the surface of the cell. Okay. And then the neuraminidase is there when they are able to make copies to the number that they want to discharge. Then the neuraminidase is a protein or enzyme that will be produced, and then they will come and do that detach for the cells to for the influenza subtypes to relocate different cells and infect them. So this neuraminidase, the hemagglutinin ranges from 1 to 18 different types, and then the neuraminidase 2 ranges from 1 to 28 or more. So if they are making copies and there is a little problem or error, then you could have a copy that probably even didn't pick either neuraminidase, but it will come out with only hemagglutinin. Okay. So recently in our records, when we pick your sample because you are showing symptoms, and then we investigate, we have been getting AH3, which is a species that has just emerged in the system. You understand? AH3, meaning that the virus is the subtype A, but when it is being, when the copy was done, it was only to pick only the hemagglutinin 3. the third type, on or five. So it means that if they are making copies, there are little errors that happens. So it makes them change a little bit within a short possible time. Now, when they change in that direction, it means that their characteristics become entirely different. The body is not aware of them again. So even as part of prevention, WHO every season or every year have to update their vaccines. The reason is that the already existing vaccines didn't include that particular one because they didn't know him or they didn't know it when the vaccines were being prepared. So now that the new one has come, the vaccine has to update it to be able to add that one to the vaccine, so that if someone takes the vaccine, it can protect that person. And remember, you can't prepare vaccines for disease-causing organisms that do not exist. And these disease-causing organisms too, you can negotiate with them, so that you say, okay, next time when you are going to make copies and change, let us know which type are you coming with, so that we can prepare ahead of time.
That's not possible.
It's not possible. So that is why each time they have a way of tricking us until they come. We don't know what to do about it. But the good news is that public health, our toes are on the ground, and we keep monitoring each second to see if there is a new thing like that. Then we are able to work as early as possible to abate it. Now, with the B type, for them, the characteristics I've just put across the A, for them, they don't have the ability to change rapidly. The change is gradual, but even if they change, they are still the B.
Okay.
You understand?
Yeah.
So they don't have subtypes, but they have lineages. Okay. I think because you are not doing academics,
Yes.
I don't want to
So you
enter
don't
there
go.
too much. So
right.
Recently, a school in Cape Coast here, 3 of the students came. They were managed, but when we took the sample, 3 of them, their results was positive for this B type, and it is called Victoria B flu.
Okay.
That is Victoria B flu, as the name Victoria B flu. Yes. And then we also have another one that is Yamagata. And this group of disease-causing organisms who are also the flu species, the B type affects only human. We don't have any evidence, data to show that, yes, we are able to isolate some of them from animal species as well. But for the A, it can affect humans, it can affect animals at the same time. So what is going on in human system, probably we might have a close monitoring to see what is happening. But what of animals? So they can change to a different group there within the animals, we don't know. And they can cross it to us at any time. So that makes the A very complicated. But for the B, whether it is Yamagata or Victoria, they are still the B. So what it means is that if there is a vaccine for them, and where the cases are, everybody have been taking or have taken the vaccine, and it means that they have a protection with it. That is why the B type do not have the potential to cause pandemics, like I'm saying. I said that before a disease can cause pandemic, then it means the whole world should have a zero immunity level. But it is never possible with the B type, because already people have taken the vaccinations over and over again. I think the Victoria was in late 1980s, where in Austria, a community called Victoria, that is why.
That's why they named it after.
And the Yamagata too is Japan. That is where the first person was, the sample was taken for investigation. The first person tested for positive for that particular. So they will name it at the community. So here where this TV station is located, what is the name?
Fort Ridge.
Fort Ridge.
Yeah.
Oh, okay. So even if we end up picking a very detrimental or fatal disease causing organism here, it will end up to Fort Ridge something disease. Oh yes.
I see.
You can't take it away. Yeah, we have Ebola, Crimean Congo, Rift Valley disease. All these things are names of places.
Okay.
Ebola, I understand, is a river body in DR Congo or something.
Okay.
Rift Valley, as you know, is a valley. Yes. in a deep forest and something. So hunters will go around trying to find something to come and feed the family. They will pick up something from them and come. Those things are there. All right, so that is what I can say about the types and what they do.
All right. Yeah. So let's say I'm affected, right? Or I'm being infected with the virus. How long does it take for me to get healed?
Okay.
Or it depends?
It depends.
Okay.
I think it depends on our immunity.
Okay.
Yes, and our immune system. Yes. So someone can show the signs and symptoms, but it takes a long period before getting to, let me say, a stage that you're supposed to come to the hospital. Sometimes, let me take this for example. Sometimes someone can get headache, or even you yourself, you can get headache, and all of a sudden it will go back. But sometimes you get a headache, and you take paracetamol for a long period, it will go. It all depends on our immune system. Each one is different. So something that it will exist in me for a long period, maybe for you for a short period, you see that your signs and symptoms will come out. So the issue is that it depends on each one of us, our immune system. So the best thing is that you have to boost your immune system. That's eating well and eating a lot of fruits and vegetables and taking a lot of water. So in case you experience that, you have the headache, the sore throat and the rest, the best thing for you is that you have to rest. Yes. So it depends on each one of us, our immune system. So what will be a short period for me, maybe it takes a long time for you.
All
so
right.
That's what I can.
Let's talk about the treatment and then the management aspect of it.
Okay.
How do we treat the virus? And then how do you manage it in case somebody that is watching you?
Okay. We all know that viral infections, you don't kill them.
Okay.
Yes. So what we do is that you have to protect yourself. So if I'm staying in the same compound with someone, or if I'm staying in the same house with you, and I realize that I'm a health personnel.
Okay.
So I realize that I'm having signs and symptoms of the flu or of the influenza. So the best thing I would do is that, since it's an airborne disease, like how COVID came, the education that went around was that you have to wear nose masks, wash your hands, and the contamination of objects, because that virus, once you spit out, or once I'm talking, see that sometimes when you talk, the spit comes out, or when you cough, the virus lives in the environment. So the environment is not all about staying in the air. Some too can be on the table, on the surface of objects or doors or something. So we make sure that you wear nose masks, you wash your hands, and on the surfaces we always decontaminate it. That's when you come to the hospital, you are always doing decontamination. So when you are in your house and you feel that you are having that signs and symptoms of the influenza, you wear nose masks, you wash your hands and decontaminate. And also you have to boost your immunity. That's the only best thing you can do. So you drink a lot of water. Maybe you are in the house or at a workplace and you feel that you're having that signs and symptoms, you can ask permission, because this is an airborne disease, anyone can get it. So you can ask for permission, you stay in the house and treat yourself. That's maybe having a lot of sleep, drink a lot of water and rest, because you have to isolate yourself so that the other person can't be in contact with the influenza. Okay, and the one thing is that as I was saying the signs and symptoms, I spoke about difficulty in breathing. You can't say that I'm having a cold, so I'm staying in the house till I get the difficulty in breathing before I come to the hospital. Maybe, what if that happens to you and no one is in the house to help you to bring you to the hospital? So the best thing is that once you start experiencing the signs and symptoms, you rush to the hospital.
Okay.
Some people can stay in the house, take all the medications they want. So it is advised that a lot of medication we take, it affects our kidneys.
Yeah, it's true.
So the best thing for you is that once you experience the signs and symptoms, just come to the hospital. Make sure that you protect yourself and your environment, especially our kids. They have let me say, their immune system is not really strong. So you have to protect yourself and protect your child as well. So the best thing is, after you do the prevention method, wearing the nose mask, washing your hands and those things, And the major issue is to come to the hospital. Don't stay in the house and be treating yourself for a very long time.
Okay.
That's all I can say about
Okay.
it.
So does nose mask protect us completely from the virus?
No, not exactly, but at least it can
Let's say
prevent
50-50.
prevent you from transmitting to the other person. So
Okay. Abu, let's talk about the vaccine.
Okay.
Is there a vaccine for the influenza illness?
Okay. Yeah, there is.
Okay.
But you know, let me talk about where he just
Okay.
landed. You're talking about management.
Yeah.
Okay. Yeah. So, like she said, you don't cure viral infections. Let me say most of them. Maybe if I put it point blank that we don't cure, it's not all viruses, but most viruses or viral diseases we don't cure, but we manage them.
Okay.
And then we treat. Sorry. So treating it means that you are putting in an intervention to prevent the disease-causing organisms to advance to the next level of their activities or their progress. There are medications like that for most viral diseases. So in the case of flu, COVID and things, there are medications to make sure that if you test positive and we think we need to put you on medications, those medications are prescribed for you and you are being asked to take them according to doctor prescription. And it is believed that you will be fine because the diseases will not have, the organism will not have their way out. They become useless, like I started explaining how the enzymes cause them to adhere, how the enzymes cause them to split or detach. All these activities will stop, and their copies they are even making, they can't make copies, they can't adhere, they can't continue like this, so they become useless. So when they are there and they are not able to do something, the body too spend time to prepare itself to come and then take over proper. So treatment is there. Like he said, you can also do your own treatment style. Like he said, you rest well, eat well, you make sure that you take yourself out of some lifestyles. Okay. Some people are alcoholics, some are on drugs. If you find yourself within this category of people, if something is even happening to you, you are sick, where signs and symptoms are at the first stage, you will not be able to pick them up. Abi, you are using something and you are high.
Yeah.
So if you are high, you are not at our level to know what is there. Once you are high, before you come to our level, then you now know say, if something is happening to you. It's when you say, I won't take alcoholism again, or you have damaged your organs to an extreme where you can still see clear and obvious signs that something is happening to me that is not okay. By that time, you have already caused a lot of harm, which may take a long time for you to recover, and a lot of resources. That is what we don't want. And so we keep saying that if something is happening to you and you think that it's a sign and symptom, they don't come automatically or they don't come as default. Something triggers it. And let me also say this. These viruses, I mentioned something and we all laugh. We don't negotiate with them.
Yeah.
So if you don't negotiate with them, you don't decide where they should stay in your body. They will now decide where they want to go. So if they are invading your kidneys and they are there, ask yourself multiple questions. What are they doing there? And what they are doing, how is it going to affect my kidney? You understand? If they're in my lungs, the same thing. You don't ask them to do this or that. The only thing is to make sure that you take the precautions that are in the health system. So you come, we investigate, and we make sure that we are able to treat you. Now back to the vaccine aspect.
Yeah.
Yes, there is vaccine, but not in our setting in Cape Coast here.
Okay.
Yes, but elsewhere in the world, they have vaccines for flu, the subtype A and then the B, and others. They have them. But it has not gotten to ours and here where we can say we have some of them like we have for other vaccines in our EPI system. For flu vaccines, we don't have them in our setting here. But for me, I'm with the perception that with time we'll get some. Like when COVID came, we had vaccines, right?
Yeah.
Everybody took it, and some of us were running away from the vaccine because of the conspiracy theories around the vaccines. People were running away from it. Now that we don't have vaccine for this one too, it's another wahala. Why are we not having vaccines for influenza? But when vaccines come, then another group will show up from nowhere to tell you that it is biblical accomplishment. And so, yes, so don't take it. If you take it, this will happen to you. Those things are there. But I'm with a deep conviction that with time we'll get some, and then we'll start giving it out. But once we are
so let me chip in this. So let's say somebody reports in your facility with the influenza illness. Now that you don't have the vaccine, for us to protect ourselves, how do you treat these people?
So the treatment is what I have just highlighted. Okay. What I'm trying to say here is that a treatment is a whole package. Okay. Like you said, you can treat somebody and get cured. You treat somebody and just make sure a symptom that is taken away. But even with these things, it has to start from somewhere. You give the person counseling. That's why I'm saying it's a package. You start from somewhere. Even before we pick your sample, we need to let you know what we are taking from you. What are we using it for? And how will it help you? This is a package that will start with you. Then if you know that this is what my people are going to do for me, and you give your consent, then we now pick your sample and assure you that we should go and continue and make sure that you receive medications to abate this particular signs and symptoms that you are showing. You understand my point? Because at that time we are still waiting on results to come to see whether it is a true flu disease causing organism that is behind it, or it's a different concept altogether. So whilst you are waiting, we don't leave you like that. We make sure we put in an intervention by way of medications to make sure that you will feel better, and also eat well, rest well, and make sure that you practice good environmental and then personal hygiene. Those things, if they are fine, you don't worry yourself that much about what will happen to me. You understand? But if you doubt your own environment and you can't pay every little detail or attention to the environment, then it means that something can happen and you yourself, you are not too sure whether it's about your lifestyle or something I could have avoided. You understand? So all those things, you put them together to make sure that you are being protected. So coming to the facility and we say that, we don't have vaccine, that is not a limitation. We not having vaccine. In fact, it's not just CCT, and it's not just Ghana, and it is not just Africa. Most places in Africa, we don't have the vaccines. And yet we are able to make sure that we are able to deal with situations. So our own is that this flu, I would have said they are friendly. The only portion that they don't become our friends is when the immune system is not there to protect us. It's not flu alone. Most diseases are like that. If your immune system is there and it is strong for you, you can be infected, but you will not develop the signs and symptoms. So the idea of vaccine is also make sure that they make your immune system very strong, so that even if you are infected, the disease will not have that progressive stage to where they can compromise your immune system and start make you feel like something is not fine with me. That is where the signs and symptoms come in. But let me make this clear. I think you asked me, and because I was talking, yes, you were trying to talk about incubation period. It is also another clear difference between what is COVID and what is flu. The incubation period for COVID is estimated to be 7 to 21 days. But that of flu is within 4 to 10 days. You understand? So that is theoretically the what is on paper that establishes the difference. So if you get the exposure today, and depending on your immune system, on the 4th day you can get it. If your immune system is so strong, or even if for a reason you don't have protection like that, but you are someone who takes good care of yourself, your onset of signs of symptoms may delay or may not come at all.
Okay.
You understand? That is all about the immune system then. So I think if I've answered your question, fine. But if I've not answered it, you can reframe it.
I think you've done justice to what I wanted to.
That's fine. That's fine. Thank you.
So, for us to prevent and protect ourselves, you suggest we live a healthy lifestyle.
Yeah.
We need to eat well.
Yeah.
We need to have a clean environment.
Yes, serene environment.
All right. I think they are not as easy as that, but then definitely as we want to live that lifestyle, we need to count on all these ones.
Yes. So you, in the first place, the personal hygiene is important. And one threatening thing is that if yourself you are clean, but the environment within which you find yourself
is not clean,
and sometimes we forget that ourselves, we are also an environment. So if you are fine, you are still dwelling within an environment that has a lot of issues. Our concept of disease transmission in a pet right is that there must be a host. Okay, there must be a disease causing agent.
Sure.
You understand?
Yeah.
And there must be an environment.
Okay.
So these things, they come together to cause disease. You understand?
Yeah.
So in this case, we here, our environment are where the chairs are placed.
Yeah.
You understand? And then we are the host. If there is any disease causing agent that we don't know or we have not seen with our naked eyes that are with us, then it means that there's a possibility of a disease causation.
Okay.
But if these two things are available without one thing, disease cannot happen.
Okay.
So we also say that we, the host, we should be able to make sure that we don't become a susceptible host or a weaker host, meaning that we should get the vaccines to be strong, so that even if the environment is there and the disease causing organism is there, we can still prevail there without suffering from any disease.
But now we don't have the vaccines. So
for this one, that is why I'm saying, for this particular one, we don't have. Okay. That's why we need to look at other things.
Okay.
Like the environment should be serene.
Yeah.
That's why I'm saying that we should look. The environment should be fine, so that we cannot say the disease is automatic.
Yeah.
Then the little thing, you eat well, rest well, is to be able to take some kind of stress. The lifestyle we are putting in place, the moment you get stressed and depressed, yes, you are finding a nice way to tell your body that you are giving up. And the moment that thing sets in, your feeding, your other thing changes, and that affects the body muscles. The immune system, like I was saying somewhere, I had a student who came to me to ask, say, he has been hearing this immune system. Senior, help me to know where exactly in the body is this immune system located. Thinking maybe if it is car, is it the exhaust, is it the engine where it is being placed? He's trying to locate it. But the immune system are our body muscles. They are the cells. Okay. So if the cells are adequate in their right amount and they are healthy, that is where your immune system becomes strong. But if you don't feed well and the cells don't find the right minerals, vitamins, the proteins, the carbohydrate that they need, okay, they are also not fine to protect you as they are supposed to. Imagine growing up, of which I know probably you did it, but even if you have forgotten, I'm reminding you. You are hungry and they are still sending you to go and fetch water or pan fufu. Even if you would do it, you will be speaking in your head, just that the thing will not come out. It's the same thing that applies to the cells. They are not healthy and you are asking them to go and fight. It doesn't work that way. So you have to be responsible for them to be active, to be able to defend you, even if you are sleeping.
Okay.
So that is how it is. So the fact that the vaccine is not there doesn't mean we are so vulnerable to the extent that we can just burn away by the virus. It's never like that. There are other ways, like we have said, to be able to stay fine with it. You understand my point? One interesting thing is that the proximity we are talking about. So when COVID was on, we, as part of the preventive measures, we said that there should be something that is called social distancing. You understand my point? So that right now, our distance is not so close. Where you are seated and where I am. Even if there are droplets or aerosol from my mouth coming out, it might not reach your end. It may drop along the line. But if you are so close, such that what is coming out from my mouth can easily drop directly into your portal of entry, then the risk is high. You understand my point? So if we are able to avoid all these things, then it means that we can also find our way whilst we are waiting for some of these vaccines to come along.
Okay.
You understand?
So just as we did for the COVID-19, social distancing, make sure we clean our hands or wash our hands very well. Make sure we put on the nose mask. Avoid public places and all that. I think that can also be done, used for the
and in our setting, you cannot say someone should avoid public places, but you go there whilst your mask, or if you think that you cannot be in mask, that is where probably you don't know what is in the environment that you are going, so you will be in mask. If you can't, then probably you have
to you go to a function and then you just only you are wearing nose mask.
That's what I'm saying. The issue here shouldn't be just only you.
Okay,
you see, we've entered these studios not because of we that are here, but it's for our listeners, our viewers, because the message is for them. They're supposed to know what to do.
Okay.
Because they should know what is going on. Knowing what is going on provides a guideline for you to choose your steps.
Okay.
But if you don't know what is going on and you are just there, you'll be there and then something from nowhere will just hit you and maybe that by that time they have to rush you to hospital setting. But you knowing exactly what to do, you not wait until you alone come in. Why in the first place are you putting on the mask before going? Because of the information you have received, and then knowing that it will be good for me to put on a nose mask and go there. If you have majority of them with that mindset and they are coming, you are not going to be the only alien. You understand? Everybody will know that now we are going to a public gathering and anything can happen. So let me prepare myself. You get there and you see people in masks and other things and go your way. But even with that, if you think that you may get there because of your mask, other friends will be running away from you because we think that this guy that is in a mask, then some is suspicious and things. Yes, but that shouldn't be it. That shouldn't be it at all. What we are trying to tell the public is that they should prepare well. One thing that is causing diseases to stay with us for a very long time is stigma. This thing that you have just highlighted is a key or a red flag for stigma. Yes, me alone. That I'm in this, and people will be thinking about what probably might have been wrong with me.
We are being realistic.
So it's a true stigma. Even if you are being realistic, you have to measure it. How realistic are you, and how is it affecting the people around you? You understand? Imagine you are in a community or in your household, and somebody falls sick, of which you all think that the person probably might have need help. Need help does not necessarily mean that the person doesn't have financial strength or financial muscles to take care of his or herself. But the person doesn't have knowledge about it. So probably he's thinking of a different thing. Meanwhile, you around probably might have been ahead of him in terms of knowledge as far as health system issues are concerned. But in as much as you have that knowledge or you have that help for him or her, if you don't do it diplomatically, don't do it the way it's supposed to be done, and you approach the issue anyhow, after all, the person is the person that is sick. Is it your sickness? The only thing is that he can infect you. But once he has not infected you, you don't have the evidence that it's the one that is infecting you. You can only predict, say, it's possible that because once you are in the same household, in the same community, the contact is a bit closer than someone who is far away elsewhere. So you find a nice way of addressing the issue, draw the person's attention to the fact that, oh, this thing, we are able to deal with it in this direction, because I be me and you here now, but of late, I've not been seeing you right, or things are not. If there is anything, let me know, and also let me know what I can do for you.
Yeah.
So if you make it this way, the person knows that you are concerned, you really want to know what is happening to him, and you have also made it clear that so that you yourself also know what to do to help. So it means that if he's able to point out something, then you'll be able to come in. Now, if he's telling you, okay, this is my problem, then you now help us to get it done. Because the risk is that if you are speaking on the matter and you don't handle it well, after all, he knows that if I'm not able to get cured, I will die. Is it you that is dying? It's not you that is dying. It's me that is dying. So allow me to die, man. Then for you to come and then harass me in my own this. You understand? Yes. And people who are nearing their grave like that, they have temper issues. So you have to find a nice way of addressing the issue so that you can gradually take the person out of the problem. And from that time, you have won the person's soul forever. Because in Cape Coast here, during COVID time, we have seen a lot and we have experienced a lot that if you don't handle your issues, the stigma that you are trying to prevent, you raise it the higher. You understand? So that's why I'm saying that you are realistic, need to be re-examined.
Sure.
You understand?
Yeah.
Because it's today that it is somebody, and you are with that somebody. You don't know what may turn against you in the next moment. So if you are handling it, you handle them in a diplomatic way such that the issue that will happen today should not continue for the rest of your life.
Okay.
Yeah, that's right.
I think our time is fast spent. Okay, so Olivia, I will leave you to share with the public your final words, and then so your final words to the public.
I think my boss has said it all.
Yeah.
And the only thing I can say is that there is a vaccine we give to babies.
Okay.
Yes, and that one is given to them from 6 weeks, 10 weeks, and 14 weeks.
Okay.
And that vaccine, there is a bit of influenza vaccine in it.
Oh, okay.
Yeah, so what I would say is that all mothers should make sure that when they give birth, they should bring their children to the hospital for vaccination.
Okay.
Since I'm a public health, I think that is what my major issue is. They should bring their children to the hospital for vaccination so that at least they will get a bit. As my boss said, that type of vaccine is not here. But the little we have that to protect our babies, we should make sure that you bring them to the child welfare clinic so that they will be immunized against such influenza diseases. And also, we should make sure that we stay in a nice and clean environment. And when someone is experiencing that signs and symptoms, you should make sure that you come to the hospital as soon as possible so that you'll be treated, than staying in the house and be treating your own. So please, my little advice is that our mother should bring their babies for vaccination, and we should make sure that we keep our environments clean. And also, we have to take in more water and a lot of vitamin C, because once you have a sore throat, even when you come, what you say?
So with the vitamin C, can you take it every day?
Not every day.
Okay.
Not every day. Sometimes it's now, even that one, they all must to build your immunity.
Okay.
So once in a while you can take vitamin C.
Okay.
But it shouldn't be like water or a food that you eat. So
some people take it every day. They add it to their water. So that's why I have to ask.
That you are
over boosting your immune system.
Yes.
Okay.
So I think
it can be an abuse.
Yes.
Abusing it. You know, medications need to be prescribed. Okay.
Yeah.
That is in a scientific setting where principles work, scientific principles work. You really have to get a prescription for medication. But in our setting here, you find it very difficult to follow those protocols, and personally I don't encourage it.
Okay.
It's so because, you know, it's now that nothing has happened to you. You think that when you go to hospital, you're trying to wait and follow the protocols to get the right thing done. You are wasting time.
Okay.
But you have forgotten that the problem that is there right now, if it is not handled properly, age is a factor. Once you are aging, things change naturally.
Okay.
Your immune system that we are talking of, it comes. Now, this disease that we have even talked about, you said our time is up, so I'm not going to talk plenty about that. There are some risk group like children and the 5 that we have mentioned. They stand a greater risk of becoming ill of the disease.
Okay.
And the children even die of it because they develop pneumonia from it, because the lungs, the virus has stayed in their lungs and has caused it to denature, and then issues start coming. And if it's not detected early, children die from it. This age factor I'm talking about also influences how the influenza affects the elderly, 65 or more years, 70, 80s. They are the group of people who are also vulnerable. Then our mothers who are pregnant, our sisters that are pregnant, or let me say pregnant mothers.
Okay.
They also stand
at risk
because their immune system will naturally be lowered.
Okay.
Yes. For you to have the cause. So during that stage, I said that you could be infected, but because your immune system is strong, you might not realize it until the immune system drops. Then during that stage that God naturally lowers their immune system, then diseases that were being protected or being handled by the immune system will now show up, because the immune system has come down and they are now up. So women too are there. And the most annoying thing is that the mother is infected. It is possible that the child will be infected. So you can have miscarriage, or you can give birth to a baby and the baby is like my fix. Small be like that, deformation and other things, all because of infections that come along with pregnancies. And that is not it. So because of our time, let me end it and say something.
Your final words.
Yes. So my final word is that I was speaking about this matter elsewhere, talking about the fact that this influenza and COVID and other diseases, but because we are here for influenza, I'm talking about the influenza alone. Their investigation, picking the sample to Noguchi and do the investigation and bring you results, is free.
Oh, okay.
You understand? So I don't see reason why you should be at home with these symptoms and still thinking that I won't come. You understand?
That is the notion.
So even if that is the notion, we are saying that for you to avoid something today, because preventive is better than cure, that they talk. It's a very heavy thing. But people, if you are not working in the sector or where we work and we have seen things for ourselves, you may think that statement is just a mere thing, but it's very heavy thing, especially when you are at the verge of dying and there are mistakes you did and you can't correct them. And we too, we are there. We are trying everything to bring you back, but the thing has already spoiled and you are going. But if you had a second chance, you see, you've had a second chance. So if you had a second chance, you would have done, or you would have do things better. By that time, no. Maybe you will not get a second chance again. So we are saying that just don't think about just come. The things that are free, we will do it for you and make sure that if we need to advance after the first diagnosis, if they are not working for you, but we think that you still need help and we need to advance, we will speak with you. It's part of the counseling with you. We'll speak with you and let you know that we have exhausted the free aspect, but we still see that you need to be able to get the right diagnosis so that we know what to give it to you. So in this sense, make sure that you prepare financially. I had a caller who was sharing his sentiment that when we come on air and we speak with the public, we make things look so simple and nice, appealing to them to come to the hospital setting. But they will get to the hospital setting, then we'll not tell them, you will pay this is the cost you will incur. And it's like we have deceived them in the first place, luring them to come to our setting, then we'll now give them what we didn't tell them. It is never like that. There are diseases that are for free, TB, influenza, COVID, like I'm saying, yes, and HIV, they are testing and other things. They are for free, except if it has to do with medications or other things that they need to buy. Even the TB and the HIV, their medications are for free.
Okay.
But the concern is, we are trying to diagnose you in the first place and know what is the problem. So if we are not able to diagnose you right, we don't know the right medication for you. And we, in our system, if you don't see anything, you don't give medication.
Yeah.
What are you giving the medication for? And what you even prompt you is in extreme cases where a clinical specialist will come together and they will now say, because of ABC, and the ABC could be epidemiological factor where the person is coming from. Has it been a confirmed case of that particular case we are discussing there? If it is yes, then we can say that the person is exposed. Then we can now talk about other things that are happening. If the clinical features and other things are matching the disease, but not every machine or every investigation machine has been able to confirm, then we can start and observe. If his changes, symptoms improves, then it means that we are on course. You get my point? And he said, yes, you're free. Then you came and then we have advanced and you have to pay something. I'm telling the public to bear with us. Don't sit there and perceive and conclude. Just take a step. Take a step yourself and know the exact thing that is on the ground. That is what I will leave for our viewers.
All right.
Thank you.
I would like to say thank you to you for coming and then sharing and then also educating us on this particular topic. I hope our viewers will do justice by practicing or doing all that you've shared with us. So tonight you heard Abu Kobrina, who is a senior disease control officer from the Cape Coast Teaching Hospital, and then Olivia Boatma, who is also a senior nursing officer also from the Cape Coast Teaching Hospital. This is where time will permit us to draw down the curtains on today's topic. So I would like to say I'll see you again next week. Take good care of yourself. Make sure you eat well, exercise, drink more water, stay hydrated, and then just take good care of yourself. It's bye for now.